It's the kind of news parents hope they will never get. That news, your child has cancer.
Seattle Children's Hospital was recently part of a global research trial that's made a big breakthrough in the treatment of the most common form of childhood cancer. And joining the conversation now is Dr. Rachel Rao from Seattle Children's Hospital. Doctor, thank you so much for your time this morning. Excited to chat with you about this.
Yeah, thank you so much for having me. I'm really excited to be here.
Yeah, so first, tell us about this type of cancer, and it's one that's apparently called the most common form for kids. What is it?
Yeah, the type of cancer we studied here is called acute lymphoblastic leukemia, or ALL. It's a blood cancer. Specifically, it's a cancer of a cell type called a white blood cell, which under normal circumstances, our white blood cells are part of our body's defense mechanism. They're cells that are designed to protect us from things like bacteria and viruses and infections. But in the case of ALL, a cell that was trying to become a normal infection-fighting white blood cell had something go wrong, some change to its genetic material or DNA that instead of allowing it to become a normal white blood cell, made it a cancerous ALL cell instead. And those cancer cells multiply and divide very quickly, gradually making more and more copies of themselves, infiltrating the tissues and making patients very sick. Ultimately, ALL, like many cancers, is fatal unless properly treated. And exactly, it's the most common type of childhood cancer we see. About 4,000 kids in the United States are diagnosed each year.
Very complex. Thank you so much for explaining that. And so there's this breakthrough here, and it involves how a child is treated, adding a type of immunotherapy to the treatment regimen. How do these treatments all work together?
Yeah, so standard treatments for ALL have traditionally consisted of medicines called chemotherapies. And chemotherapies work generally by targeting and attacking cells in the body that are growing and dividing really quickly, like cancer cells. But they're not terribly specific, and they can attack and damage normal cells in our body as well, making patients feel nauseous and have vomiting and hair loss and things like that. But blinatumomab, the medicine we use, works quite differently. It's called an immune therapy because it uses the patient's own immune system to help fight the cancer. It's a two-part medicine. On one side, it attaches to the cancerous ALL cells, and on the other side, it attaches to the patient's own T cells. And T cells are a normal cell in the body that helps fight off things that are dangerous to the body by killing them. And so when you attach the cancer cells to the T cells with blinatumomab, it allows those T cells to kill the cancerous cells, literally using the patient's own immune system to seek and destroy the cancer cells. So it works quite differently than our usual treatments do.
Fascinating. Doctor, I understand that you co-led this global trial with researchers in Toronto and it significantly improved future prognosis. Explain how that works.
Yeah, so this trial was one that we conducted with a group called the Children's Oncology Group, which includes over 200 hospitals in the United States, Canada, Australia, and New Zealand. And it's a trial that I led along with my colleague in Toronto. And the trial asked the question of if adding blinatumomab to standard treatment would improve outcomes for children with ALL. And so it was a randomized study, meaning patients were sort of like a flip of a coin, assigned to either receive our standard treatment alone or that same treatment plus 2 cycles of this new medicine, blinatumomab. And what we found is that the patients who got blinatumomab were far less likely to have a relapse of their disease, meaning the disease comes back after you've achieved a remission. In fact, 96% of patients who received blinatumomab survived without their disease coming back, compared to about 88% of children who got chemotherapy alone. And that's really important because if the disease relapses, it's really far harder to cure. And so reducing relapses significantly reduces the number of children ultimately dying from this disease.
Wow. So maybe that speaks to my next question here. With this breakthrough, this regimen is now considered the ideal standard of care for children. Can you expand on that?
Yeah, so the trial was designed to say, is this going to be better than what we're currently doing, what is currently considered standard of care? And the results of our trial demonstrated that, yes, adding blinatumomab to treatment is better than what we've been doing, so that then it immediately becomes the new standard treatment. The results of the trial were actually so positive that we stopped the trial early because we knew with those results that we had to just start giving patients with this disease blinatumomab to achieve these great results. And, very quickly after we announced the results of this trial, hospitals, including our own Seattle Children's, started having meetings to say, how can we give blinatumomab to all of our patients? Can we go back and those patients who maybe didn't get it on the trial, can we now give them blinatumomab? And, as of now, just a year after that trial result was announced, kids around the country are getting blinatumomab just as part of their standard treatment now.
I have to imagine that even you as the researcher were quite blown away at the results of this, yeah?
Yes, we were really surprised. I was actually on vacation in Whistler when we got the results, and it was striking. You know, I never thought in my career I would be a part of something that was so dramatically positive that it immediately changes the standard of care, immediately changes how we treat patients, immediately improves outcomes for the most common type of cancer that we see in kids. So yeah, we were pleasantly surprised and have been really excited about this result.
And this breakthrough has already been recognized with a prestigious award. Can you tell us about this David Sackett Trial of the Year?
Yeah, that was another really nice surprise. The David Sackett Clinical Trial of the Year award is a global award given to one trial conducted anywhere in the world that has, essentially significantly improved healthcare outcomes. It's been awarded to trials that have improved outcomes after severe COVID, reduced the risk of death with postpartum hemorrhage, things like that. So I think it really puts the results of this trial in context. There are thousands of children diagnosed with ALL in the United States each year, but there are tens of thousands of children diagnosed with ALL around the world each year. And, we've disseminated these results to our colleagues in Europe. We've talked in China, UAE, Colombia, Mexico, Egypt. And so now, physicians all over the world are giving their patients blinatumomab based on the results of this trial. So if you're talking about reducing relapses by 61% in tens of thousands of children, that really translates into thousands of lives saved across the world.
I'm going to say, bottom line here, what do you think is the end result for, patients that are going to be diagnosed with this in the future from here on out?
Yeah, just as we acknowledge, this is now the new standard treatment for patients with this disease around the world. I think we're all really grateful for the families who participated in this trial that demonstrated that this is the way to treat patients. This is the way to achieve the highest rates of cure that we've ever seen. This is the new standard of care that will be applied for all patients diagnosed moving forward. I also think it speaks to the power of research, how important conducting research trials like this are, how research directly saves lives, and why it's so important to continue doing medical research.
Dr. Rachel Rao from Seattle Children's, thank you so much for joining us with this important topic today. We appreciate it.
Thank you so much for having me.
Blown away.
What a breakthrough.
Yeah, thinking about the impact that this is going to have on not only kids here in Western Washington, but really around the world, giving them a fighting chance at growing up and going into adulthood and doing all those things that we want kids to do, which is graduate and pursue a career and all that, and not have to, and live their lives. That's what it comes down to. And kudos to her and the team in Toronto that did all this great research and came up with this. It's incredible.
Kudos.